Hello everyone, I'm Dr. Ramkaji Baniya, resident physician at Hurley Medical Center in Flint, Michigan.
And I am Dr. Prabin Sharma. I'm a hospitalist at Yale New Haven Health, Bridgeport Hospital in Connecticut.
Today we are going to discuss about our article recently published in GIE journal entitled Balloon Interoscopy versus Spiral Endoscopy for Small Bowel Disorders, a systematic review and meta-analysis.
So what was the main objective of conducting this study?
Two novel endoscopic procedures, balloon endoscopy and spiral endoscopy, have revolutionized the diagnostic and therapeutic approach to small bowel disorders. These disorders that historically required surgical intervention are now investigated and managed non-surgically. There are only a few weakly powered studies that have compared the outcome of spiral and balloon endoscopy. So we conducted a systematic review and meta-analysis to compare the efficacy and safety of these two procedures. So how did we do this study?
For this systematic review, we searched PubMed, Cochrane Library, Scopus, and clinicaltrial.gov databases for all studies published up to January 2017. We looked for studies that compared the efficacy and safety of balloon enteroscopy, either single or double, and spiral enteroscopy. Primary outcomes of interest were diagnostic and therapeutic success rates, and secondary outcomes included procedure length, depth of maximal insertion, rate of complete enteroscopy, and adverse events. Odds ratios were calculated for categorical variables, and mean differences were calculated for continuous variables. Mintel-Hengel method was used to analyze the data. Fixed and random effect models were used for less than 50% heterogeneity and more than 50% heterogeneity, respectively. And what were the main findings of this study?
80 studies met the inclusion criteria for this meta-analysis. A total of 615 procedures were analyzed, which included 394 balloon enteroscopy and 221 spiral enteroscopy procedures. There were no significant difference in diagnostic and therapeutic success rate between these two procedures. Similarly, depth of maximal insertion was not significantly different. However, the procedure time was significantly less for a spiral enteroscopy group. A subgroup analysis comparing double balloon enteroscopy with spiral enteroscopy yielded a similar result. So what was the final conclusion of our study?
Our study shows that balloon enteroscopy and spiral enteroscopy are equally safe and capable of similar diagnostic and therapeutic outcomes with minimal adverse events. There is no significant difference in depth of maximal insertion between the two procedures. Spiral enteroscopy has a significantly shorter procedural duration compared to balloon enteroscopy. However, the diagnostic yield and interventions were comparable. To conclude, either of the techniques is acceptable for small bowel exploration. Spiral enteroscopy is the procedure of choice when a faster evaluation of small bowel is required for oral procedures, but not for anal procedures. The biggest limitation of our study is the quality of the studies that are currently available on this topic, most of them being non-randomized, single-center studies of small sample sizes. Randomized control studies with larger sample size on this topic need to be conducted in the future. More detailed information on our study is available at GIE, Gastrointestinal Endoscopy Journal. On behalf of all co-authors, we thank the GIE Journal for this opportunity to present our research in a video format. Thank you everyone for watching this video.
Thank you.